watching My 9 News at 10.
The ad campaigns promoting congestion pricing as a strategy to reduce asthma has left many city residents scratching their heads. People in areas with the highest asthma say the plan may not help the area where they live. Joanne Pileggi is here with that exclusive story. Joanne?
Brenda, the Bloomberg administration says traffic would decrease by 6% inside the congestion pricing zone, ultimately improving air quality. But the city's worst asthma problems exist outside of Manhattan, in the Bronx, Brooklyn, and Harlem. So people there are asking how much their air quality will improve, if at all. In the South Bronx, kids play in a playground just a couple hundred yards from the Cross Bronx Expressway, where auto emissions are indeed heavy, considering the volume of traffic.
All that pollution is really hurting a lot of kids and also adults.
Taisha Garcia is a medical receptionist who sees a lot of asthma patients where she works. She also has a 3-year-old son with asthma.
He wasn't born with it, but after he started getting the asthma.
And she's not convinced a congestion pricing plan will benefit people in the Bronx. Neither is this doctor who treats asthma patients.
I'm not sure if these new policies in the city will help these populations that we see here in the South Bronx.
Mayor Bloomberg is hoping his plan for congestion pricing in Manhattan will force people to use mass transit, in turn reducing traffic and improving air quality.
The South Bronx, along with Harlem, have some of the highest asthma rates in New York and probably in the country as a whole.
Doctors we spoke with say any plan that reduces exposure to toxic pollutants will benefit public health. But they wonder who will be the beneficiary of cleaner air, considering there are bus depots in Harlem and such heavy traffic in the Bronx.
Any congestion pricing plan would necessarily be designed to avoid any increase in air pollution exposure in the communities on the boundary of the congestion pricing area.
In Brooklyn, the communities of Bushwick and Williamsburg also have high asthma rates. Activists applaud the idea of congestion pricing to reduce pollution, but say it may not help their community either.
We're going to still have the bus depot that we have, so in terms of traffic patterns, I don't anticipate that they're going to be radically different.
There are clearly other triggers for asthma in the city: mold, dust, and rodent infestation, but doctors say pollution is a big factor. The question remains how much pollution can be reduced by congestion pricing. I'm Joanne Pileggi, My 9 News.